twist, fall, or sports injury. And now there's pain and swelling. Is it a sprain, or could it be a fracture? Knowing the difference can help you respond safely.
What is a sprain? A sprain is an injury to a ligament, the strong tissue that connects one bone to another. It commonly happens when a joint twists or moves beyond its normal range. Typical signs include pain, swelling, bruising, and difficulty moving the joint. The joint may still be usable, although movement can be painful.
What is a fracture? A fracture means a bone is cracked or broken. Possible signs include severe pain, swelling, bruising, deformity, or an abnormal position. You may hear a snap or crack at the time of injury, but not always. Here important is you cannot reliably tell a sprain from a fracture just by looking. An X-ray or other medical assessment may be needed. And warning signs of a possible fracture are: seek urgent medical care if there is. 1. Visible deformity. 2. Severe or worsening pain. 3. Inability to use the limb. 4. Numbness or tingling. 5. Pale, blue, or cold fingers or toes. 6. An open wound near the injury. 7. Severe swelling.
What to do right away? Stop using the injured area. Keep it still and support it in the position you found it. Apply a cold pack wrapped in cloth for short periods to help reduce swelling. Do not apply ice directly to the skin. Do not try to straighten a deformed limb or push a bone back into place. Sprain or fracture. When in doubt, treat it as a possible fracture and get medical advice. Protect it, keep it still, and seek professional evaluation.